Hi
Hello,
guys.
everybody.
Yeah, as you're entering, please remember to keep yourselves muted. We want to um, have as like the least amount of distractions as possible, and then keep your cameras off, please. Dr. Riley will be asking some questions, so then when he asks the questions, you can go ahead and unmute yourself. But for now, please keep yourselves muted. We'll wait about a minute or two to let some more people in as they trickle in.
So, question, this is a majority pre-medical students. Okay. Can you guys hear me like clicking on my phone?
No.
Now, okay. Just want to make sure because I was like, because I can hear it in my headphones on my mic, and I was like, oh, that's
No, we don't
annoying.
hear you.
No.
To those that just joined, just please remember to keep yourselves muted and we'll start here in about a minute.
Okay, I think we are good for now. We can start.
Okay.
So good morning, everyone, or afternoon for where you are. Thank you so much for signing up to attend this virtual shadowing session. Just a reminder, please mute yourselves and keep your cameras turned off. Unless asked by Dr. Reilly to ask or answer questions, then you can go ahead and unmute. So we will be asking 2 questions throughout the chat, and you must answer both for verification, and they're not going to be hard. We just want to make sure that you're actively participating, staying engaged. So please be on the lookout for our name in the chat. So now we're going to introduce our very special guest. Please join us in welcoming Dr. Reilly. He is an emergency medicine resident. Thank you so much for joining us today, Dr. Reilly. Please take it away.
Yeah, of course. Hi, everybody. Dr. Reilly, Chris Reilly. It's still weird when people call me doctor because, in residency right now. So, I was just in med school like 6 months ago. So I am an emergency medicine resident. What is emergency medicine? A lot of people ask that question because, everybody's kind of confused by television drama series that say like, oh, everything's a code and everybody's running around like everything's on fire. So emergency medicine is a subspecialty of medicine where you treat everyone who comes in the door. Somebody could be in cardiac arrest in one room, and then the next room somebody could have broke their toe, and you got to take care of that. And that's one of the big reasons why I love emergency medicine, because it gives you an opportunity to practice so many different aspects of medicine, and it keeps you up to date on all these different types of medicine. So that's one reason why I love it. Another one is, work-life balance. I'm a huge believer in personal wellness, and actually being mindful of being present. And when I'm not at work, I am away from work. Like, I do not look at things. I do not follow patients in the charts or anything like that. I make sure that, obviously during residency, you still have to study, you still take quizzes, and you still do your readings. And, that's just a part of it. That's medicine. You're constantly reading, you're constantly learning. It never stops. And, I've talked to many docs who are in their 60s who are still reading every day because there's so much information to know. And there's a lot of stuff that you need to brush up on, because it's pretty, or medicine in general is pretty extensive, especially in a specialty like emergency medicine where you have to know a little bit about everything. Everybody says jack of all trades, but a master of none. I kind of don't agree with that because I feel like we are masters of resuscitation. If somebody comes in they're septic and they're hypotensive, their blood pressure's crashing. Like, we are the people that everyone turns to. Like, you need to resuscitate this patient, bring them back, which is amazing. It's really cool to see that happen. I also like seeing things done like immediately. You do a lot of pretty cool surgical procedures, like minor surgical procedures. I put in my first chest tube the other day at a rural freestanding emergency department. This one kid had a pneumothorax, which is basically in the lung, you have the lung and then you have the pleura, and there's a space in between. You're not supposed to have any air in that space. And what happens is air gets in somehow and compresses your lung. So you need to decompress that, and you have to put like a tube into somebody's ribs. So I did that my first time the other day, which was awesome. So it's things like that that keep me excited about emergency medicine. Another aspect is the personalities. The physicians that I work with are like the coolest people ever. So down to earth, you know, and they're really encouraging, and they want to teach, and they, you know, everybody talks about burnout and people not caring. And from what I've seen, it's been very, you know, they're super engaged, and they really want us to be the best physicians that we can be. So yeah, emergency medicine, that's kind of why I got into it. All right, there's a chat already. Okay.
That was us.
Oh yeah. Okay. So I'm going to tell you guys a little bit about myself. I am from New Jersey originally, from the Princeton area. I went to undergrad at Johns Hopkins University down in Baltimore, Maryland. I played baseball there. GPA wasn't good enough for med schools, so I did okay on the MCAT, but the GPA just wasn't there, so I had to take a gap year. I was suggested to do master's program or post-bac, and I did one at Drexel in Philadelphia. And after that, applied again, didn't get in again. And I was like, what is going on? Like, you know, I'm putting all my effort, all my, you know, time into this because I really wanted it. And then after 2 times getting denied and taking a second gap year to scribe in the emergency department, I finally just said, you know what, I'm just going to go for it. So I actually went to St. George's, which is a Caribbean med school. I'd met many docs that I worked with that were graduates from there, and they had jobs. They were emergency medicine physicians. I've met plenty of doctors who went to Caribbean med schools. Some of my best friends are some of the smartest kids I know, and they were in my class. So I just want to give you guys a little encouragement, because there is no one set path, right? We go through life, especially when we're younger. In high school, we all think, oh, we're going to go to high school, and then I'm going to go to college, and then I'm going to go right to med school, and then I'm going to go to resident. Like, nothing ever happens like that. So anybody feeling down about gap years or whatever, you know, people say, oh, it's not right. Maybe your parents are getting on you about it. I've heard that's the thing. And I've had many friends who their parents got very down on them, but they, you know, stuck to the course, and they put their work in. They invested in themselves, which is the most important thing you can do. Taking the DO route. Actually, guys, I'm gonna answer questions like when I'm done, you know, talking to you guys a little bit first. So I'll take a look at the chat after that. But yeah, so, you know, when it comes to gap years, I feel like I matured a lot more. I learned a lot more. I became more goal-oriented and focused on my end goal, which was to be a doctor. I knew that going to a Caribbean med school, there's a risk. There's a risk there. You know, if you don't do well enough, or you don't pass your board scores, or you don't get good enough board scores, there's a chance you may not match in residency. And it's a lot of money. It's a lot, like right now it's $450,000, like, to go to one of these big Caribbean med schools. Obviously, if you take the max loans, that's what I'm saying. Some people don't take the max loans. Some people have their parents help them out. But that it's a risk. And I took the leap and I said, you know what, I'm investing in myself and I know that I want this and I'm 100% committed to this. And that was it. And now I'm in residency and it's pretty great. And that's it. So I basically just wanted to tell you guys, if you are taking gap years, don't be discouraged. Nobody's path is set. Everybody has different ways of getting to their end goals. Some people go the shorter route. Some people take, the roundabout way. There's a ton of detours. Myself was, I was one of those people. So don't get discouraged. If this is something you are 100% committed to, and this is something you really want, then the world is yours. You guys have that fire and that determination. You can get there. I promise you. So, all right, let's see what we got here in the chat. Tips for re-applicants. So re-applicants for medical school. Okay. I think the biggest thing for re-applicants is that you have to have something dramatically change on your application, right? So for me, that was scribing. So if you have an incredible medical experience, or maybe you want to do Doctors Without Borders and, or go build, Habitat for Humanity, those kind of things, those are great things to add to your resume. But if you know your weakness on your resume, maybe it's not being involved in organizations, maybe it's actually your GPA. Like myself, I was a college athlete. So a lot of my time was taken away from the classroom at a very competitive pre-medical program at Johns Hopkins. And a lot of that time taken away really hurt my GPA, where some kids are getting 3.8s, 3.9s from Hopkins. I was at a 3.2. And that was tough for me because how could I keep up with the other kids that were having a 3.8, even though I was playing baseball and doing all that kind of stuff, which is great for a resume. But at the end of the day, that's not gonna get you into a med school. So if you are honest with yourself, that's the biggest thing. Just be honest with yourself and say, what on my resume is lacking? What I actually did is I emailed programs that denied me my first time. And I was like, what went wrong? What did you guys see? Like, what was the big thing? Or I would call them and just be like, hey, how can I be better? What can I do to improve my resume for next cycle? And for me, it was my GPA. And, even after going to Drexel and taking first year med student classes with the students, it's the same tests, quizzes, all that stuff. And I got a 3.5, and it, that in first year med school classes pretty much. And that wasn't good enough either, because, no one takes that into account. They're like, oh, well, it's still kind of low, but they didn't take the whole, first year med school classes, because 3.5 in med school is pretty decent. But I actually graduated with magna cum laude and from my med school, because I that kind of stuff made me more motivated to be better in the classroom. And I ended up having like I don't even know, like 97 point something GPA in med school. But anyway, use that as motivation. Use it as a chance to realize where you went wrong, how you can improve on it. And again, a lot of these programs are receptive to feedback, so they will tell you what's lacking in your application. So that's my advice for the re-applicants. Any advice for DO route? So honestly, there's been a lot of controversy lately on the DO topic, and there is no difference, guys. There is zero difference. Some of the best doctors I've ever worked with or learned from are DOs. Like just brilliant emergency medicine physicians. Half of my class, they're DOs. And honestly, there's this MD-DO kind of personality stigma, because DOs are more down to earth and MDs are more like, I'm kind of floating above you, like I am all knowing kind of thing. And that's, something I've noticed over time, because a lot of the highly trained specialists are MDs, but there's also a ton of DOs. Like my buddy is at a neurosurgical residency at Mount Sinai in New York. There are plenty of DOs in his class. It's this stigma, and it stinks. And it's the same thing for Caribbean grads too. There's always a stigma. But I think the most important thing you can do is block out all the noise and realize at the end of the day, you're going to be a physician. And you got into medicine for the patient, right? You are there to take care of the patient in their most vulnerable time. These people look to you. They're looking for answers from you. And it doesn't matter if you're an MD, DO, US international medical graduate, non-US international medical graduate. If you have the medical training, you are a physician. Your job is to take care of people, and people are going to look to you for that. So at the end of the day, the whole DO route versus MD route, it's the same, guys. I know there was like a whole controversy with FIGS, with their ad recently with the female DO. I mean, obviously life is all about perspective and relativity. I would never know what it feels like to be a female or DO, right? Because I'm a male MD. But at the same time, I thought to myself, I'm like, well, I think they may be feeding that fire by reacting instead of being like, no, I'm a doctor. Like, I don't care what anybody says outside of that. So as long as you guys are confident that you are getting the right kind of training in a DO program, which you will, again, some of the best docs I've ever worked with or known are DOs. It'll be completely fine. I know there's a lot more DO programs popping up all over the country. So I know there's a lot more opportunities out there to match into a DO program. So that's my advice for DO. And emergency medicine, there's a ton of DOs in emergency medicine, like a lot. It's very, emergency medicine doesn't really care if you're MD, DO, whatever. So that's that. What do you think of the bad reputation of Caribbean medical schools? So this is exactly what I was just talking about, right? So no matter what you do, there will always be a stigma that follows you, right? The stigma is slowly dying away because there's more and more US international medical grads matching. This year, my school had, I think, over 1,000 applicants match, which is pretty substantial. And, I think that speaks volumes. Plenty of St. George's grads are just killing it right now in the medical field. And I feel like it puts a chip on your shoulder. When I first went to St. George's, I was like, what am I doing? Like, this is ridiculous that I'm down here. I don't even know if I'm going to match. And I felt inadequate, and I felt scared, and I felt, defeated kind of. I felt like it wasn't really a big deal for me to be in med school. And I had this kind of imposter syndrome where I would think to myself, am I actually going to do this? Is this actually going to happen? And one day I had a realization that honestly, like, you are your own investment, right? The Caribbean med schools give you an opportunity to get your MD, to take the exams and pass the exams. And everything else outside of that is up to you. I tell everybody that. I have tons of students reaching out to me on my Instagram asking me, hey, like, what's your thoughts on St. George's? What's your thoughts on Caribbean med schools? I say the same thing every time. There's a chance that you may not match, right? There's a high match rate in internal medicine and family medicine. And from internal medicine, you can go into any specialty you want, like cardiology, gastroenterology, all these, medical specialties. So there's a high match rate for that. And again, your scores and how hard you want to work, that's on you. You are your own investment. So anybody looking into Caribbean schools, you need to be 100% committed and 100% sure this is something you want to do, because it's a lot of money, it's a lot of time, and it's a pretty big mental toll. I mean, it took a big mental toll on me and an emotional toll. You know, you're away from your family for 2 years. You're on an island in, you know, in the Caribbean, which after exams though was always so much fun. The beaches there are just like crazy, crazy beautiful. And I had some of the best memories, and I've met some of the best people I'll ever meet in my life at St. George's or in the Caribbean. So, okay, let's see. What is your most difficult and memorable case in your career? By the way, wow, thank you. I appreciate that. Shoot your shot. Oh my God, that's funny. Most difficult and memorable case. So honestly, like, you know, being a first year resident now, I've done some difficult cases, but at the same time, in terms of difficult cases, was probably during my third year of med school. I was on my trauma rotation at Hackensack University Medical Center in New Jersey. And there was an 18-year-old kid who was driving his dad's Corvette really fast on the highway and went under a tractor trailer and just was super messed up. It was really bad. And he, at the time, my youngest brother was 18 years old. You know, he's a football star. Like, my brother goes to Lafayette. He's a linebacker at Lafayette. And at the time, he was in high school football player. This kid was a high school football player. He was 18 years old, the same age. They looked really similar. And it just like made me hop into the thought that, oh my God, like this could have been my brother. Like, you know, it shocked me, and it was very emotional. And after we stabilized him, we had to, you know, intubate him, and we had to drain a lot of blood from his lungs and kidney, and he had a lot of internal organ damage. And we brought him to the ICU. And then me and the main doc went in and had a conversation with his family, which again was very similar to my family. And I just remember walking home that night, and I just like broke down, and I couldn't like really take it emotionally. It was very, very tough. That was definitely my most difficult and memorable case. And it was important for me to deal with, because it made me realize these are, you know, because you go into room after room and you see patient after patient, and you need to reflect that these are people with lives outside of this moment right now. They're scared, they're vulnerable. They look to you for your advice, for your help. And I think that's really special, that we have that opportunity to do that and actually be there for these people. So that's definitely my most difficult emotionally and mentally and memorable case of my career so far. You know, I'm sure I'll have many more difficult cases in the future too. So totally resonated. What were your thoughts about doing post-bac? What did you do while being in post-bac research? So my first year of post-bac was a master's program at Drexel. So it was basically, you take first year med student classes with the Drexel med students, same lectures, you know, quizzes, tests, all that stuff, same curves. And I thought it really prepared me for medical school. But at the same time, I kind of wish I did an easier master's program that would have just boosted my GPA. But again, that's looking back and me going, oh, I wish I would have known that. And that's why I'm here, because I want to share this information with you guys. So if you could find a master's program that can pad your GPA, if your GPA is actually the problem. If your MCAT is the problem, just, I mean, I think it's the most useless test in the entire world. It really has no correlation to medicine at all. I mean, even step one, the USMLE exam, like, it's basic sciences. It's like biochem and like anatomy and physiology. And I'm just like, and genetics too. Like, what is the SMN1 mutation in this patient? What, like, and I'm just like, what? No, I'm never going to need this in the emergency department ever. So I think the first useful test you'll ever have is step two, which is the second USMLE exam. But in terms of MCAT, guys, just, I know it stinks, but you just do it. And pass, get a little bit above passing. Yeah, I just want you guys to know it really, I don't think it should be a thing, to be honest, but they need some sort of objective way to rank people, unfortunately, based on GPA and MCAT, because so many kids apply to med school. So in my post-bac, I pretty much just did classes because it was first year med school, like workload, which was a lot. And I also volunteered. So that was in Philadelphia. I would volunteer at this place in South Jersey called the South Jersey Field of Dreams. And it's a baseball organization for mentally and physically challenged children. And that was actually just, I've been involved with them for many, many years. It's like my favorite thing to do volunteer wise. But if you guys can, again, go to a program that you can excel in and have a good GPA in. I think that's the most important thing. Research too. I mean, if you have time for research, yeah, go ahead. I mean, I did research at Johns Hopkins School of Medicine, actually on ALS mutations, which was really interesting. And I thought it was a great opportunity and a great learning opportunity for like bench research. But again, some people like bench research, some people don't. I knew I would probably never do bench research after that. And, in terms of clinical research, I think that's more, something that you would want to push towards, because that's what med schools want to see. Like, are you interested in clinical research as opposed to, lab and bench research? Because that's more PhD, MD route, or just PhD in general. And then volunteering, yeah, I highly suggest trying to volunteer as much as you can. What GPA do you think a person should? So I think your pre-med advisors at your schools are your best resource for this. Depending on if you have a good relationship with them or not. I've heard of some that are very abrasive and they only say like, hey, this is the cutoff that you should not apply after this. Don't listen to them. A lot of them just go off of averages and numbers, and a lot of them are not very empathetic because they deal with this every day, and they lose that. They become a little jaded, which stinks, but it's, I guess it makes sense. They just need to be cognizant of that. So a GPA, I mean, it depends what kind of school you go to too. Like, my school was grade deflation for sure. Johns Hopkins is known for grade deflation and like super cutthroat pre-med program. Like, kids are like, oh man, it was toxic. But the pre-med program. So if you're going to like a very competitive school, like undergrad, probably a 3.6 and above, or 3.7 and above, you should be good with GPA. And if you reach out to these programs, if you get denied an interview or something, you could just be like, hey, what went wrong? Like, what do you suggest I do better for my GPA? So I think the cutoff's normally like 3.7 and above. But again, that was years ago that I applied. I applied in like 2015. Yeah. So, it's probably changed a lot more. It just keeps getting more competitive every year. And, doing a post-bac or master's, that's on you guys. That's up to you. That's personal preference. But if a GPA is your problem, I highly suggest doing it, because that's the only way you can fix that aspect of your application. How would you choose between going to a more prestigious medical school versus one closer to your family? So again, once you're a doctor, you're a doctor. It doesn't really matter where you went to med school, unless you want to do like a crazy, competitive fellowship in something after residency, or a crazy competitive residency. If you want to do like orthopedics or neurosurgery or plastics, you want to do something like that, try to go to the most prestigious med school you can. But if you want to just do emergency medicine, or you want to be internal medicine or family medicine or general surgery, it doesn't matter where you go to med school, because once you get accepted into that residency, you're fine. So doesn't really matter. So personally, I would probably do the family / support groups, because being in Grenada by myself, I mean, I wasn't by myself. You have to branch out in med school. You have to make friends. You can't have the gunner attitude where you're just like, oh, I'm just going to study all the time. I'm never going to share my notes. I don't want to study with other people. Like, no, you got to like branch out. You got to have friends, because you are each other's support group. And that's something I learned pretty early on in med school, because there were some kids that were like very abrasive and like, I don't want to, hang out. And I was not. I'm a very outgoing person. And so that was that. So I personally, I mean, looking back, if I matched into a US medical school, I would probably want to stay close to family and support groups, because I think that's super important. Scribing experience. So I was telling these two that I actually, my scribing experience was a lot different than the typical scribing experience. Most scribes actually follow the doc around to every room and then type while they're in the room. So I worked at a site in Trenton, New Jersey and Hopewell, New Jersey. They were great sites, great docs I worked with, but most of the time I was kind of just at a computer typing. So if you are going to do the scribe thing, I would make sure the program was like really, helps you get involved, like in patient care, like going into the room, seeing exactly what's going on, because that's going to get you more interested in emergency medicine. It's not all about charting. I hate it. Right now we have like voice charting, with like a voice charting program. And if I didn't have that, I would be so behind on my charting and all that stuff. So, it's super important, and especially in emergency medicine, because we have such a litigious society. Everybody's trying to sue for everything. So, so scribing, super important skill. You learn the medical language. You learn what or what not to include as pertinent positives or negatives in your notes. What questions to ask patients. Like, if somebody comes in with back pain, you have to ask them this certain subset of questions to rule out actual emergencies. And while I scribed, if anybody came in with back pain, the doc would say the same things, like no saddle anesthesia, no urinary or bladder incontinence, like these kind of things that, no IV drug use history. And I like always wondered, I'm like, why do they always say the same things? And then I asked them and they're like, oh yeah, these are things that are associated with actual back pain emergencies. So that was pretty eye-opening. So I thought scribing was a fantastic experience in terms of boosting my knowledge, especially in the emergency department. So, as we talked about, you can do a post-bac master's. It depends what your weakness is in your application. If you don't have enough volunteer experience, go to Habitat for Humanity, go down to Venezuela and build some houses, like, do whatever that you have to do to make your application stronger. So how did you find your reason / purpose for why you want to go into med school? So, so my dad actually is a funeral director, right? And so my whole life I've been around that. And it's really unique because not many people know anybody who's a funeral director. My dad's like the coolest guy I've ever, like he's my best friend. Love the guy. And there was one funeral I had for an orthopedic surgeon. His wife died of cancer, and we got to talking for a while, like at the funeral. And then he became kind of like my mentor. And he was like, hey, you want to like come shadow a couple surgeries and me at the office for a day? And this was about when I was like 16 or 17. And I was like, yeah, for sure. And I was like, whoa, this is so cool. And that was like my first experience in medicine. And I was like, this is what I should be doing. So, a lot of people have their, sick family, members. That's a very typical story for why someone got into medicine. But I think mine was more about gaining perspective on someone's, losing someone that was also in the medical field. So I thought that was pretty unique. How did you deal with your stress? So I play guitar and I sing, and I would actually, I started a like a live music thing at a local brewery down in Grenada. And that was so much fun. I would do that after every exam. I'd play for like 5 hours with my one buddy who's a vet student. Well, now he's a vet, but he would play the drums and I would play guitar and sing, and we'd play for forever. Also, working out is huge. Just make sure you find something that you actually love doing. So, so the thing with Caribbean med schools that is difficult to deal with is administration stuff, because there's a lot of negativity from the admin. But the reason why there is it's almost like a fear factor. They want you to realize like, hey, like you need to do really well on these things. If you don't, they say, oh, you're not going to match. But a lot of it's just fear tactics, because a lot of my friends that didn't do that well in step 1 and 2, they still matched anyway. They got their residency positions. So I thought that negative attitude was kind of, bad. But at the same time, like, I get it. You have to do something to motivate your students besides being like, hey, you have to do well. Like, you can't just say, yeah, you got to do well in step 1, so that was their method of doing it. Also, living in a third world country was pretty crazy. Sometimes you go to the grocery store and they wouldn't have eggs or bread, or because the shipping container got like caught at a dock somewhere at a different island. So that was interesting to deal with. But I've had, again, some of the best experiences of my life from Caribbean med school. And yeah, I mean, my clinical rotations were fantastic. Hackensack Medical Center in North Jersey is a fantastic hospital. And I got a lot of great experiences there, as well as some New York City hospitals, like Lincoln in the South Bronx. I did that for an emergency medicine rotation. That was kind of crazy. So honestly, I've had a pretty good experience. I know there's a lot of kids out there that talk bad about Caribbean schools. Either they went there and they didn't do what they were supposed to, or they just made themselves miserable because they, again, didn't have a solid friend group, or they didn't want to explore the island or do things outside of studying. And I think anybody anywhere at med school who does that is going to be miserable and hate their med school. And then there are people that never experienced it personally, but they still talk bad about it. I remember there's one Instagram account, MCAT something, and they talk bad about Caribbean med school. And I was like, thinking about it, I'm like, well, did you ever experience it? And again, this goes back to relativity and perspective. Only your hardest, like your most difficult situation. When I have a friend who's a teacher, and he's like, yeah, man, like, it sucks. Like I'm dealing with all these kids all the time and grading. And I was like, well, it's all about perspective. That's what he knows as his most difficult thing. And I only know what I know as my most difficult thing. So somebody outside of the perspective of Caribbean med school, they can make all sorts of judgments and accusations, but they actually don't know what they're talking about because they've never experienced it. And they've never tried to step out of the box and say, hey, let me think from a different perspective. Maybe this is actually a good thing for the US healthcare system. We don't have enough primary care doctors. We don't have enough internal medicine doctors. Everybody's going specialty routes. So maybe it's a good thing that we have Caribbean doctors. So again, life's all about perspective. If you had to choose again, yes, 100%, I would do emergency medicine every time. And again, it's like, because you are seeing people at their most vulnerable, you're seeing everyone, and you're seeing some super critical patients and then some not so critical. So all the boring patients, you're like, oh my God, like, oh, great. Like, this guy's pee burns, like, great, awesome. Here, pee in this cup and we'll test it. And then 2 seconds later, somebody rolls through the doors, they got a gunshot wound, and you're like, oh my God, I gotta do something. Or somebody's like going into respiratory failure and you got to intubate them. Like, that's so cool to me. And again, like, I'm in my first year of residency, so this is super exciting. So yeah. What were your 4 years of med school like? Any highs or lows? Oh, tons of highs, tons of lows. Again, that's life. That's the journey of life. It's strange. Like I said before, there's no one path. Like life's kind of like a roller coaster, and there's tons of ups and downs. And of course, I had some big time lows. Everybody makes med school seem so glamorous on Instagram. There are tough times. There are really tough times. It's a very rigorous path that I took and a lot of other people have taken. And, obviously the highs are fantastic, but the lows sometimes, man, there were times where I'd just be like, is this worth it? Can I keep going? I don't know if I can. But then again, if you have a good support group around you and, you stay in contact with your family and your friends, like, you can get through those lows. Study tips. Biggest study tip I have is when I was in med school, a lot of people would be like, oh, I spend 16 hours in the library. And I would go like what? How could you possibly be focusing for 16 hours? Like no human can do that. And then, I'd keep an eye on them in the library and, they're getting up out of their seat. They're going to talk to their buddy. They're on Instagram. I am a huge believer in interval studies. So what I would do is I would set my timer for an hour, and I would just like shut off everything, airplane mode for the phone, for the computer, everything. And I would focus like for that hour. And in that hour, I would try to read back in my mind what I was reading and try to explain it to myself. Or if I was studying with other people, I would use the whiteboard and I would like write out, biochemical pathways and discuss them out loud. That's the best way to learn, is teaching someone. You retain, I believe, 70% of what you learn if you are able to teach it to someone, versus highlighting and passive studying. I think you learn like 15% of what you're actually reading. So I'm a huge proponent of teaching what you learn. Even if it makes you uncomfortable, just do it. Just go through that. Doing as many questions as you can and really looking into the explanations for those questions and trying to teach back in your mind, and then setting intervals of an hour or 45 minutes at a time. You maybe start 30 minutes at a time. If that's all you can do, that's fine. But you slowly build up, just like anything else. Like going to the gym, you don't just put like 225 on the bench and just start going. No, you start with one plate, or even tens on the side. You start low and you work your way up. It's all about stamina. So after that, I would take 15-20 minutes to just walk around or talk to my friends or whatever. And then once that timer went off, I was like, all right, guys, got to get back to studying. So that's my biggest study advice for you guys. Scribing experience, again, I talked about it. Describing 100%. My scribing experience influenced my choice in emergency medicine. And I think the biggest thing I got out of that was the personalities of the docs I worked with. And I slowly realized over time that all the EM docs are very laid back. They're very cool people. They're very calm, especially if, things start to go wrong in the emergency department. They're very level-headed. And I wanted to be that. I was a pitcher in college, and that was, when you're on the mound by yourself, everybody's looking at you. They're looking for you to be clutch in those moments. And that's what I feel like emergency medicine doctors are like. Describing. Honestly, I think the biggest piece of advice I can give for people trying to choose what they want to do is keeping an open mind. Being open-minded on your rotations in medical school, third year, is the best thing you can do. Do not close your mind and say, I am going to be this. I am going to be this, because you actually may end up really liking one of your rotations. All of my rotations I actually really enjoyed. But when I got to my emergency medicine rotation, I was like, yep, this is it. This is what I want to do. So it'll hit you like a ton of bricks when you figure out what you actually would like to do. What are your views on applicant with more experience and good standing in that? I think this would, honestly, this is obviously not a shadowing experience, right? It's not. it's an opportunity for you guys to learn from what I've learned over my many years pursuing this. That's why I'm doing this. I want you guys to not make the same mistakes that I made, and to know information that I didn't know at the time, and information I wish I knew. This is a fantastic opportunity for you guys to learn a ton of information. So yes, I would include this for sure, because it's really cool idea, and you guys are actually learning if you're here. If you're here and you're just like, you know, muted and you're like off playing Call of Duty or something, then I mean, you can put it, but I mean, the whole point of this is to help you guys out. It's not really about, you know, putting it on your resume or whatever. Doesn't cover lift, still not taking shadowing experience. So I think a lot of med schools would understand too that this is happening. You know, these are extenuating circumstances, and a lot of them will understand there's no shadowing opportunities right now because it's too dangerous at this time. You know, we're now seeing a surge of COVID in Florida right now. Everybody's saying, oh yeah, it's going away, whatever. It's not, it's still here. I had a guy like yesterday that came in like short of breath, like super sweaty. I had COVID 2 months ago. It was terrible. It was awful. I was sick for like 2 weeks straight. So I don't think that's going to be lifted anytime soon, unfortunately. So yeah, what is your schedule as a resident like? It is not as flexible / desirable as that of an ER attending. So med school is really tough, right? Everybody says it is. And then residency is even more tough, or tougher. You are kind of just given your schedule and you have to work. In emergency medicine, we have max 60 hours, as opposed to every other residency, which is like 80 hours. And the reason is because when we're on shift, we don't have lunch breaks. We don't have any break time. We just go from patient to patient to patient. And most of our shifts are 12-hour shifts. Sometimes we'll work 5 days in a row, 12-hour shifts, like just seeing patient after patient after patient, going to resus, going to this, going to that. So I pretty much just eat like, I don't know, like power bars while I'm on shift. There's really no time to even go to the bathroom sometimes. But at the same time, that just how emergency medicine is keeps me excited about it. So it's not really a big deal. So the PA route versus MD route. I never really looked into it too much because, again, my first exposure to medicine was with orthopedic surgery. You know, and I chatted with him for everything. So I didn't really have that perspective of PA. And do you work with PAs? So currently in my hospital, because of COVID, they had to let all of the mid-level practitioners go, which is PAs, NPs. So it's literally just residents and docs running the emergency department, which gets crazy sometimes because a lot of the PAs would do less acute stuff. So they do like laceration repairs, and, you know, if somebody has an abscess, they like, you know, cut into the abscess and drain it and that kind of stuff. Or, you know, if somebody needs splinting for a broken arm, like they'll do that. But now that we don't have that, instead of us focusing on higher acuity patients, we have to also worry about fast track stuff. So the hospitals kind of put the brunt of, you know, getting rid of PAs and NPs on the residents, which kind of stinks. But it is what it is at this time. You know, COVID. My favorite quote this year is, "It is what it is." That's what I tell everybody. Or "What a time to be alive." That's another good one. What was your why for medicine that allowed you to stay so committed through the reapplication process? So you know, as I said before, I knew I was 100% committed. This is something that I'd been working for many years, and I didn't want to give up on it. I'm also a pretty stubborn person. So, and I love the science. I love medical science. I think it's so interesting. And I think it's so cool that I have the privilege every day to go into a room listen to a patient's story and then have an idea of what's going on in my head, do a physical exam, run labs, interpret the imaging, and then tell them what's going on. I think that's so cool. So it was little thoughts like that that continued to help me go forward. I also have an amazing family and amazing support system who were always behind me 100% on my dreams. So again, the support system's so important. How do you effectively prepare yourself for a bad incoming call? I think the best thing you can do is take a deep breath. Take that 30 seconds to like close your eyes, get some good breathing in, and really prepare yourself for the worst. When a trauma comes in or somebody who's coming in by EMS and they're super sick, we're told sometimes a little bit advanced, sometimes they just roll through the door and you don't really have that time. So it's like, take 20 seconds to just do some breathing exercises and just calm yourself down. Stay calm, cool, and collected. So inspired by anyone within your family? So I actually am the first doctor in my family on either side. No one was really involved in medicine at all. Again, just my first exposure was with that orthopedic surgeon who was fantastic. And again, that was just my personal experience. So I have no tips for anybody with kids through med school and residency. I have friends who did it. I don't know how they did it. Especially in the Caribbean, some of them had to leave their kids back home with their parents. I had one friend who, her mom just like took care of her kids for 2 years while she was down in Grenada. And I can't imagine the emotional toll that would take. But if you're at a US med school, I think it's a little bit more doable. It's your full-time job, right? So if you have a partner that would be able to support you financially, emotionally, I think that's super important, having that support system, because you're on loans. So I don't know what the deal is with government loans. If you have kids, like, do they give you more money? I'm not really sure. That's an interesting question though. Okay. So I've talked about what really made me want to get into emergency medicine, which is the acuity, being able to help people at their most vulnerable. Work-life balance is fantastic. The procedures, like I was saying, I had my first chest tube the other day. Critical decision-making, multitasking, teamwork is like the principal pillar of emergency medicine. Like, you are a team. You have nurses, you have techs, you have EMS coming in. Like, you all need to work together, and it's all about teamwork and communication. And being sports based my whole life, like, I'm all about that. So also staying up to date on like the most like up to date research or clinical research for all these different types of things in emergency medicine is really cool. There's so many great podcasts out there. If you guys also, I have a podcast. It's called Reslife, RESLIFE, where me and my buddy, he's in his neurosurgical residency at Mount Sinai, me and him just talk about different things for pre-med students to look into. We talk about our advice on the road to medicine for med students, pre-med students, and even residents, or anybody who's just interested in medicine in general. So if you guys want to check that out, that's on Apple Podcasts. So the cool thing about emergency medicine residency, you said, is there another field that you would like really want to do? Again, third year, like, I really enjoyed all my rotations. And the cool thing about emergency medicine is that you have to do all these off-service rotations in residency. So like next month I'm on orthopedics. So I'll be doing orthopedic surgery. I'll be working in the clinic. So that's really cool. I just got off OB, where I had in emergency medicine, you have a requirement to deliver 10 babies by yourself. So I did that recently, which was really cool. Such an amazing experience, bringing life into the world. First one, I saw was in med school. It was shocking, but this one, I'm actually there delivering the baby, which was, and then, you deliver it and you give it to mom and you just see, you're like, wow, that's just crazy. It's just crazy. So yeah, you have incredible experiences in all different types of medicine. We do a cardiology rotation, we do neurology, we do, because stroke alerts and stuff come in, like we have to treat stroke, heart attacks, all that stuff. What do you like best about EM? As I said before, I've kind of covered that. Has it been hard? So in emergency medicine, we move from room to room very quickly. So it's really hard to get emotionally attached to your patients. But something I do, and I make sure that I do, is find something that I can have in common with each patient. Whether it's, a t-shirt they're wearing that says like a band that I like, or, I'll be like, so where are you from? Like, or how about the Tampa Bay Lightning game the other day? They just won the Stanley Cup. So this city's been like nuts for that. It's a good way to connect with people, because I feel like having that disconnect leads to burnout, and it leads to you just not caring and you not taking the time to realize these are people with lives. They have families at home. They have so many dreams, goals, aspirations in their life that you don't know about. But taking a second to reflect on that while you're in the room is super important. That's how you, stop the burnout, but you also can't get too emotionally attached. There are some patients that are just, you're going to be affected by, especially pediatrics, because we see a lot of peds as well in the emergency department. So, you're going to get emotionally attached. But again, the way to combat that is to care. It's a spectrum, like care, but don't care too much, if that makes sense. Like show them that you care about them and their life and their dreams, goals, aspirations, all that kind of stuff. But at the same time, you need to be ready. As soon as you leave that room, you need to be ready to see the next person and get involved in their life for a minute. Yeah, lifelong learning, that is definitely something that doesn't stop. Studying's changed based on my work schedule, how exhausted I am when I get home. So as I said before, I'm big into podcasts. So an emergency medicine podcast that our program provides us with is MRAP, which are like the leaders in emergency medicine knowledge and education. And so I'll listen to a podcast on the way to work, and then I'll jam out on the way back home. It's like 20 minutes away from where I live. So I think that's really important. Podcasts, quick way to learn some pearls and stuff. But, if shift isn't busy, if it's a 4 a.m. or something and no one's coming in, I'll bring up practice questions online and I'll do them. And then days off, I'll read some chapters out of my huge textbook. Actually, that's over there. It's like this big. It's like all of emergency medicine in it. But we have required reading, we have required quizzes, we have required lectures that we do in our program, and it's really tough. It's really tough to find that balance. So yes, hours per night or per week studying. Oh man, so most of our shifts are 12 hours, and we still need to finish up notes afterwards. So that's 13, sometimes 14 hours, and then we come home. I like to work out, so I want to get that in at some point. So that's already like a 16-hour day. So maybe like an hour of studying, like not much. Obviously in med school, it's a little different because that's all you're doing. But then third year and fourth year are your clinical rotations and you're studying. So it's like pre-residency. That's basically what it is. Because now I'm getting paid finally, but like absolutely nothing. We don't make any money. I think we should be making a lot more, but we're not. Let's see, attendance question 1. What's the attendance question, guys? That's just to them?
Yeah, that's just to them. But
Just to,
there's a
like, get
few
them
kind of
thinking.
like sprinkled in. I could just read those out to you if you want.
It's
Yeah.
also, it's like noon or 1 p.m. So I don't know, if you want to keep going or if you want like,
Well, I mean, I see there's like 99 new messages. So,
so if you want, like, people can always message you or however you want to handle it. It's up to you. I mean, you can obviously keep going for as long as you want.
yeah. I mean, I think if you guys would like, I can do an Instagram live for you guys and just, answer whatever questions you put in my chat. How about we do?
Yeah, there's some people saying that would be great.
Okay. Yeah, let's do an Instagram live. Can I just like let you guys know when I'd be able to do that, and then we can put
Yeah,
something together?
people are really excited. There's people saying yay and
Oh, okay, good. Because I mean, I literally saw like 99 plus new messages, and I'm like, also from New Jersey. I'm from Hillsborough, New Jersey. I don't know City MD. But yeah, no, I'm more than happy to chat with you guys a little bit more. Again, this whole process is super scary, very intimidating. You hear so many different opinions about it. And I think a lot of people focus on negatives instead of positives. And that's really tough to deal with, especially as a young person, right? I mean, I'm 28, so I think I have a little bit more maturity than I did at your guys' age. I have a lot more perspective on life now. But I remember those days. I remember being scared. I remember just feeling vulnerable and feeling like, wow, am I good enough to do this? Is this something that I can do? So you guys are not alone. Everybody out there who's applying to med school is scared. They feel vulnerable. They feel like they're not good enough. They have this imposter syndrome kind of thing going on. But again, if you're 100% committed to this and this is your goal, this is your dream, go for it, guys. So, yeah, I'll be happy to do a Instagram live. If you guys could post, maybe, I'm trying to think, I might be able to do it next Friday. So we could put something together like that. I think that'd be cool.
Yeah, and we can chat about it and then we can share it with everyone.
Yeah, absolutely.
What your Instagram handle is.
Yeah, so my Instagram is Doc Riles. So it's DOC. Here, I'll just type it in the chat. Doc Riles. But yeah, that'll be cool.
Thank you
I'm
so
excited.
much.
Yeah, of course.
I think we got so many good tips from you. And
I was about to say, I feel like I just gave all of my tips. Like, I can't think of anything else like I would like to say. Like, please, like, take my advice as somebody who's gone through the gamut. Like, I've been I literally went to a different country to go to med school. That's how committed I was to it. Please listen, please heed my advice, and block out the haters sometimes, guys. Like, there's a lot of haters out there, and there will always be haters. So keep doing you.
thank you.
Yeah, of course.
Awesome. Thanks everyone for coming as well. Go follow Dr. Reilly on Instagram, and we'll be letting you guys know when we get our little live set up.
Yeah, absolutely. And if you guys, are interested in podcasts or anything, you can check out Res Life too. That's, I think we have 8 episodes now. But I think the next one we do is going to be tailored for more pre-med students. I think we're going to record it this Sunday. So, all right.